Okay, let's talk about the muscles of the body. Make sure you go back and review the things we did before, like how you name the muscles. Naming them after the location, naming them after the shape, the number of heads, the insertions, the origins. So some examples like the brachioradialis that starts in where? If it's brachio, it's referring to the arm, and it tells you it inserts in what bone? Brachioradialis. It's the radius. So it tells you exactly where it goes. Think about the locations. If you have something that is abdominis, where would you look? The abdominal region. If you had something that said femoris, where would it look? In the femoral region. So a lot of the words will actually tell you what they mean. They may say the number of heads, like the bicep brachii. It's telling you how many heads, 2, bicep, and it's telling you the location, brachii, the arm region. Or tricep brachii, 3 heads in the arm region. So be careful, go back and review how to name muscles. Pay attention to the flexions, the extensions. Look for things like abduction, adduction. Watch the key words. As you go through these, I'm going to list off the ones that you have to know, you absolutely positively have to know, so you're not confused and wondering what you have to study. You're not studying over 600 different muscles that you don't have to know. So what I'm going to have you do for an assignment is you're going to take the piece of paper I told you needed to have, or the notebook that I told you to get, and you're going to write assignment on the top, make sure you put your name on it, and then you're going to put these 4 categories, just like in the picture. You're going to put the muscle, the origin, the insertion, and the action. And I'm going to list off the muscles you need. Sometimes I'll tell you the origin, sometimes I'll tell you the insertion, and sometimes the action. If I don't tell you one of those 3 things, then you need to look it up on your own. So this is kind of an intense participation. So I gave you a couple examples. For instance, if you're looking at the bicep brachia, the origin is the scapula. I'm not going to be super specific and say you have to write the coracoid process of the scapula. I just want you to know the major bone. The insertion would be the radius, so where it reaches out to. And if you don't remember, I always told you think, if you can't remember, just where's the closest to the center of the body. So whatever part of that muscle that's close to the center of the body is always going to be the origin. Wherever it reaches out to and attaches to when you're developing embryologically, that's where the insertion's at. So if you're talking about the bicep, of course the scapula is closest to the center of the body. And if you reach out on your arm to the forearm, that's where the radius is at. So origin scapula, insertion radius. As far as actions, think about the action. Move your muscle in that position. Grab a hold of your bicep and tighten it. What joint do you notice moving? Is it the shoulder or is it the elbow? It's the elbow. The bone that is the insertion is always the bone that should be moving. It's another rule of thumb to pay attention to. So the joint in between the muscle and the bone, that's what you want to pay attention to. What's happening to the elbow when you tighten your bicep? It pulls up. It pulls up like you're going into the fetal position. So what would that be? Extension or flexion? Well, fetal position, moving into the fetal position means flexion. So you just write those 3 pieces of information. You write the bicep brachia down because I told you you had to know it. You write the origin, the insertion, and the action. And you see I also did the tricep brachia for you. The tricep has 2 origins. It has the scapula and the humerus, so I put both down. I was a little bit more detailed because I told you how important understanding the olecranon process was, so I put in here for the insertion the olecranon of the radius. I'd accept the radius, but sometimes go just a little bit over. As long as you have the right bone, I'm okay with it, but if you can find the actual location, then it's always better for you. Get involved. Make sure you're having fun with it. Another fun thing you could do is when you're naming the muscles, you can actually get a marker or some kind of thing they'll write on flesh, and if you have a significant other, just have them take their clothes off and write all over their body. That always makes it really memorable. So it's a lot of fun to learn that way. And then, of course, with the triceps, there's the action extension. Or another way to do it is pull out your coloring book. If you got one of the coloring books, you just pull that out and just start coloring the muscles. You want to take your time. This is a lot of rote memorization. This is probably the driest material you'll have for anatomy and physiology because it's just memorizing all these new things. It's like a different language. I told you that the first week. It's just a bunch of Latin or Greek names that are describing the muscles, what they look like, where they're attached, the arrangement in the body. So take your time, make it interesting, and have fun with it, whatever you have to do. Right, so here are a lot of the muscles you absolutely positively have to know. These I would put big, huge stars by because you absolutely positively have to know every one of these. When I give you your next test, I might have something like this diagram or picture labeled with just like the thorax, and then you have to plug in a couple of the names underneath it. I might just have the facial. I might just have a big blown up version of the head, and you have to name these specific facial muscles. But these you'll absolutely positively have to know. You'll see these as I go through the slides, and you'll see other ones, but these, I'm telling you one more time, you absolutely positively have to know. These are all superficial muscles of the body. And these are really important because a lot of times these are landmarks. When you're looking at somebody's skin, or you're looking at their bones, or you're looking for an insertion site for a needle or a surgical cut, a lot of times they'll use these superficial muscles to describe where they're at. So you absolutely have to know them. These are the anterior muscles, and these are the posterior muscles. All right, let's start with the head. So when you're taking your notes, go ahead and make a little section for the head, and we're going to go through each of the ones you have to know one by one. Right, why do we have the facial muscles? Facial muscles are for a lot of things. They're there for expression. Like, you can read somebody's face just by looking at their facial muscles. It's amazing. You can tell when somebody's happy, when somebody's sad. You can tell when somebody's faking a smile just because of the way the facial muscles work. Another unique thing about the facial muscles is that they don't always insert from a bone to another bone. A lot of the facial muscles actually start on a bone and they insert in the skin to move the skin into different positions. They're a lot thinner. They're a lot more sensitive. When we talked about alpha motor neurons, we talked about how eye muscles have very, very few motor units. So they're very delicate movements, very precise movements. They're very small muscle groups. When you look at some of these slides, like down here, it says it's innervated by cranial nerve number 7, the facial nerve. You don't have to know these now, but when we talk about the brain next week and the week after, we're going to come back and talk about the cranial nerves. We're going to talk about certain muscle groups and what they're innervated by. The word innervated just means that a nerve controls it. So a nerve's going to run from the brain or the spinal cord straight up to this muscle group and control it. All right, so the first one's the face. Now we're actually going to start with one that's not just the face, but it's actually all the way across the head. So the epicranius goes all the way across the top of the head. It starts up at the frontal bone, comes all the way back over the head, and attaches to the occipital bone. So this is a unique muscle because it has this huge tendon in between two muscle bellies. The belly's the bulging part. So if you touch your forehead and you kind of, what would that be, grimacing, I guess is the proper term, and you shrug your muscles above your eyebrows, that area of the epicranius is called the frontalis. So you can see the arrow pointing at the frontal belly, but the actual name is the frontalis. Right? If you go all the way to the back, you have the occipitalis. Why? Because that's the name of the bone it lies over. So again, some of these muscles are pretty easy to know as long as you know your bones. Like, there's the frontal bone with the frontalis. There's the occipital bone with the occipitalis. So if you're looking at this one over the temporal bone, what would you call it? It would be the temporalis. So a lot of them just plug in super easy. Don't make life more complicated than you need to. Like I was talking about with the epicranius, you have this huge sheet, and here's an important word, aponeurosis. So anytime you see a broad sheet-like tendon, it's called an aponeurosis. This one has a special name. It's called the galea aponeurotica. It's just a broad sheet across the top of your head. If you put your hand on the top of your head and you shift around, you can feel your hair and your scalp shifting over that big flat tendon. It's not a muscle. You can't flex anything up there. It just slides around a little bit. Okay, so I've already listed off the epicranius and the two bellies that you have to know. I just listed off the temporalis, and you can see the temporalis has this connection on the temporal bone, and it goes all the way down to the jawbone. And what's the fancy name with an M for the jawbone? The mandible. The temporalis and the masseter is this other massive muscle here, are two of the primary drivers of chewing, so mastication. They're also two really important muscles to know because if you've ever heard of somebody having TMJ, or temporal mandibular joint disorder, those are the two muscles that are affected. That's when they get a lot of tightness in their jaw, especially when they clench at night when they sleep, and it causes a lot of pain, grinding of teeth, and discomfort. When you look at some of the names again, if you look at something like orbicularis oculi, we talked about this. The shape of the muscle sometimes describes the name. So orbicularis tells you it's an orbit or around something, so it's a circular muscle like a sphincter. Oculi is telling you it's around the ocular region. When we talked about microscopes, I said that this is the ocular area where you put your eye, right? So orbicularis oculi goes around the eye. If you look down here, the orbicularis oris is just the same, but it says oris, so what cavity would you expect that to go around? Right, the oral cavity. Look at the words. A lot of times if you kind of squint your mind, I know it's a weird thing to think, but if you squint your mind a little bit, the word kind of pops out at you. Orbicularis, it orbits around something. Oris is the oral cavity. Right, some of the other names and themes to watch for. If you have a levator labii superioris, Labii or labia refers to lips. So where would you predict this muscle is going to be at? Well, it's going to attach to the lips. So the levator is telling you the action. What's it going to do to the lip? Well, squint your mind a little bit and just throw an E on there. Elevator, labia. It's telling you it's elevating or lifting the labia. Superioris is telling you which labii. So it's telling you the upper lip. Now remember, a lot of times in Greek or Latin, if you just read the name backwards, it tells you. It says upper lip elevator. If you have an upper lip elevator, you also have to have a lower lip depressor. So you just name it opposite. So if you look down here, you have a depressor labii inferioris, telling you it's the bottom lip. So sometimes when you look at patterns like this, they pop out, and if you find the patterns, it's even better because then your mind's creative and you're putting the pieces together. Right. Next one, I like this one, depressor anguli oris. It's telling you it's doing what to the mouth? It's telling you it's pulling down on the corners of the mouth. Depressor is pulling down, anguli is at the corner, or the angle of the mouth, oris is telling you the mouth. So mouth angle depressor. It's making you frown. The platysma is a cool one. If you kind of tighten your chin, really tight, and you grin and kind of grit your teeth and feel your neck, you can feel all like the sheet across the front of your neck getting all tight. If you look in the mirror and tighten it up, you can see how kind of disgusting it is. But it's a thin sheet-like muscle that goes all the way from the chin and across the mandible down and into the upper part of the chest. It's a broad sheet. These are superficial. They're superficial muscles. We're going to take and cut these back and actually look at muscles that are underneath. They're not bolded. So what you want to do is go through, if you need to pause this or whatever, write these down. I'm actually going to come back and talk about a couple other muscles on here, but not yet. So you can write these down, and you can go through and find the origin, the insertion, and the main action. Muscles of mastication. So I already actually talked a little bit about two of them, the prime movers of the jaw, the masseter and the temporalis. There are a couple more. There's a side-to-side movement, and that's the pterygoid muscle. Side-to-side, when you think of watching a cow chew, how the cow kind of grinds its teeth sideways, that's the pterygoid. The next one is the compressor of the cheeks. It's called the buccinator. It pushes the food in, so if you get food like stuck over on the side of your cheek, this muscle squishes it back into the teeth so you can chew on it. If this muscle over-tightens while you're chewing, what would you do? You'd bite your cheek. And then, of course, you'd suffer for about 10 days. So here are the main muscles for mastication. You see the temporalis. There's the masseter. Here's the buccinator. It shows you the main ones. What did the buccinator do? It pushes the cheek in, pulls the cheek in, and helps you smash the food into the center of the mouth. Excuse me. When you're looking at the pterygoids, pterygoids shift the jaw back and forth to the sides. So you can grind, take those molars at the back, the flat teeth, and grind things like vegetables down. So when you're chewing like a cow, eating all those vegetables. The next head muscles are going to be the tongue muscles. Two words to watch for when you're talking about the tongue would be lingual and glossal. Like when you take a pill sublingually, it's talking about taking it from underneath your tongue. If you're talking about glossal, it's talking about the muscles that are shifting the tongue. The tongue itself is a muscle. It's a strong muscle. But there are also synergistic muscles that help assist with movement. So when you look at this, all these terms have glossus in it. Genioglossus, styloglossus, hyoglossus. And a lot of them are telling you the locations and the insertions and organs. So stylo is referring to the styloid process. When we talk about the temporal bone, here you have that needle-shaped structure that's projecting up. There's the mastoid process, there's the styloid process. So here you're talking about the styloglossus. It's going from that styloid process down to the tongue. Hyoglossus is going from what bone? The hyoid bone up to the tongue. Right? If I said that there was a muscle called the sternohyoid muscle, where would it be attached? It'd come from the sternum to the hyoid bone. And we're actually going to look at that one too. Right. If you look at some of the muscles of the neck, here's one of my favorites, the sternocleidomastoid. It tells you its origins, the sternum, the clavicle, and it goes all the way up to the mastoid process that's on the temporal bone. When we dissected the cat, we talked about some of these other muscles, like the digastrix. Digastric, remember you had digastric on this side and another one on that side. We looked at the stylohyoid. We also looked at the thyrohyoid. So if you look all the way down here, the thyroid cartilage, all the way up to the hyoid bone. We looked at the sternohyoid. That goes from the sternum down here all the way up to the hyoid bone. And then here's the actual human cadaver that shows the different muscles. So here's the sternum, here's the clavicle, you can see the sternocleido, and it goes all the way up to the mastoid. If you turn your head hard to the left and you feel the major muscle poking out in the front of your neck, that is a sternocleidomastoid. Right, let's shift that around a little bit and look at the head. Underneath the sternocleidomastoid, if we cut that away, you have a small set of muscles called the scalenes. You have an anterior scalene that sits more to the front, you have a posterior that sits more to the back, and you have a middle scalene. The scalene is also assessed with head movement or rotation. Let's look at the posterior part. So if we turn the head around completely and look in the back of the neck, here you can see the vertebra, here you can see the mastoid process. This is the splenius capitis. It's telling you it's coming from the spine and going all the way up to the head, the capitis. Okay? Splenius cervicis is telling you it's coming from the spine and coming up around and wrapping over and grabbing the cervical bones. So if you imagine this tightening, this pulling will tilt the head sideways or laterally to the right. The back muscles are very intricate, and there are a lot of them, but I'm not going to expect you to know every one of the names. The major group is called the erector spinae group. If you look at what it does, what do you think it's going to do? Erector spinae group. Squint your mind a little bit. Erector is telling you it's going to make you stand up straight, right? So it's going to erect the spine and pull it straight up. Collectively, this is a big group of muscles. If you feel your back when you tighten your back, it's that bulging set of muscles to either side of the spine. So the spine's processes the bump to go straight up the back. Feel the groups of muscles to either side. Those are the erector spinaes. If you break them down, there are three groups, and I'm not going to make you know the groups inside of them, just what they do in general. You can look at them. The iliocostalis. They come from the ilium, and go all the way up to what's costal telling you? The ribs. Okay? The longissimus goes all the way the length of the spine, all the way up to the top. And then spinalis hug the spine's processes very close. Like I said, I'm not going to make you remember all of them in detail, but collectively, the erector spinae groups have three muscle groups that erect the spine, and they're the ones that bulge out to the side. Another really important muscle is actually called the quadratus lumborum. When people get lower back pain in their lumbar region, this is the primary muscle that causes the pain. So you can see it stretches across the ilium and attaches to the lumbar and the costal regions. So quadratus is telling you there are 4 insertion points. Lumborum is telling you it's where? In the lumbar region. Excuse me. Some of the more intricate muscles on the vertebra, and I'm not going to make you remember these, but the names kind of tell you where they are, or what they do. Like the rotators are going to do what to the vertebra in the spine? They rotate it. They turn it on its axis. If you look at something like the intertransverse areas, this is between the transverse processes. So the name inter is telling you it's going between the transverse processes. If you look at between the spinous processes, if this is intertransverse, this must be the interspinals. So it's pronounced interspinalis. The only ones you have to know on here are the ones I've discussed before, and then the erector spinae. You don't have to write all of the different intricate back muscles down. Next are the muscles for breathing, and you have to know these absolutely positively. Breathing is an interesting process. When you breathe in, it's an active process. It burns energy, and you contract 2 sets of muscles that are really important to know. You contract a set of muscles that are in between the ribs on your chest, and you contract the diaphragm, the very powerful muscle at the bottom of the rib cage. Right? That's when you breathe in. What's interesting about breathing out is that you just turn all of your muscles off in your chest. You shut them off. And because of all of the connective tissue that has elastic properties, your chest goes back to its natural position. Let me show you. So here are the intercostals. Inter means between, costal means what? Ribs. The external intercostals are on the outside of the ribs. So when they contract, they pull your rib cage outward, pushing away, and upward. They expand the size of the lungs. They make the lungs more round. The internal intercostals would do just the opposite. If the externals pull the rib cage up and out, the internals must smash it or pull it down and in. When you breathe in deeply right now. Which of these are working? When you inhale or breathe in, it's the external intercostals that are pulling up and up and out. They're expanding your lungs and sucking air in just like a syringe. If you take a needle and you pull back on the plunger, the syringe creates a suction and pulls air into it. When you expand the size of the lungs, they create a suction and they pull air in. The other muscle that's really important, the actual plunger at the bottom, is the diaphragm. I'm not a huge fan of this picture, but you have to imagine you're standing at the feet of a patient. You're looking at their rib cage. You're looking basically from their feet up to the ribs, and you're seeing this diaphragm that goes all the way around, a continuous sheet muscle. It connects ribs, the sternum, and the vertebra, all the way 360 degrees. When this thing excuse me, is in your chest, it actually sits in an arched fashion. Imagine drawing a line across the bottom of your rib cage. So point at your sternum on your chest, at the very bottom of the xiphoid process with both of your, the pointer finger of both of your hands. Put them together. If you drag your fingers along the rib cage, notice how the bottom of the rib cage arches as it goes laterally. When this muscle contracts, it goes from an arched position to a flat position, pulling down on the lungs, lengthening the lungs, and helping you inhale, just like pulling on the plunger on a syringe. Okay. This muscle is really unique because it also has 3 holes in it. The holes are important because the diaphragm separates the superior part of your body, basically your thoracic cavity and up, from your inferior part of your body, which is your abdominal cavity, and down. So when you get something from your mouth or your nose down into the lower part of your body, it has to go through the diaphragm. So if you, I don't want to say inhale air because that stays in the thorax, but if you were to drink a soda and inhale gas bubbles at the same time, you have to get that food and that liquid and those gas bubbles down in your stomach. They have to go through a special hole that's just for the esophagus. And this is the foramen of the esophagus. It's a special feature. Foramen means what? It means a hole. This is a hole for the esophagus when you swallow food to go down and drop it into the stomach that sits just below the diaphragm. You need to get blood from the heart down into the lower body. So pumping blood from the heart down, you go through the foramen for the aorta. So as it goes through, you'd have the descending aorta, which is the thoracic aorta, and into the abdominal aorta. It goes through this hole. And then to get dirty blood, or used blood, deoxygenated blood, back up, you go in through the vena cava, which brings the blood back to the heart or returns it back to the heart. So you have 3 holes, 1 for food and 2 for blood vessels. Next group is the abdominal wall muscles. There are 4 you're going to pay attention to. Well, actually there's a 5th one that we're going to talk about just briefly, but there are 4 in the abdomen. We've already talked about these before in class too, and I told you how to remember them. Look at the directions. So if you start out here, the external obliques, you know they're going oblique or diagonally, and they go down towards the groin. So the grain of the muscle or the direction of the fibers goes down towards the groin. There's a huge sheet-like tendon here, and it's an aponeurosis. It's that term I referred to when I talked about the top of the head. So the aponeurosis of the external oblique is a broad sheet. When we looked at the cat, we saw that broad sheet across the center of the abdominal region. If we slice through, the next layer is the internal oblique, and look at the grain. It goes in an opposite direction. Externals go down towards the groin, the internals go up towards the rib cage. If you make a 3rd cut, you have the transverse. So the transverse abdominis goes in the transverse plane. The fibers go perpendicularly across the body from its center axis. And then finally, right up the center of the abdomen for doing crunches, pulling your body down into that crunch position, you have the rectus abdominis. Rectus means they're going up and down in an erect fashion. Abdominis is telling the region. And then right down the center, an attachment point is called the linea alba. So you can see this long tendon that goes over the belly button and all the way down. So 4 sets in the abdomen. The 5th one I was talking about, we're going to talk about again later, but the serratus anterior we looked at in the cat. It's this just above, just above the rib cage, and it looks like a serrated blade. Here on the human, you can see they're not really thick. So when you get ripped abs, when your abs are, like, you have that definition, that six-pack, or I guess nowadays people are getting the eight-pack, the muscles themselves really aren't that thick. The trick is to thicken the muscle a little bit and also lose the fat on the surface, because you can see how thin these muscles are, each layer. You can see the external oblique and their fibers going down towards the groin. You can see the internal oblique and the fibers going up towards the ribs and the sternum. And then you see the transverse abdominis and then going perpendicular to the midline of the body. And then even with the rectus, you can see they're going straight up and down. Next, there are only a few muscles you have to know right now for the pelvic floor. When we talk about reproduction later, we'll actually spend more time. So the first one is called the levator ani. And you can see the levator ani go all the way across. They form a pelvic floor so that the abdominal organs have something to rest on. And it's important in men, but it's really important in women, because after a baby, after squeezing a child through this, a lot of these muscles get loosened, and then the internal organs can slope down a little bit and wiggle too much, like, for instance, the uterus. The coccygeus muscle right over here is really important for supporting the uterus. So when you do Kegels, you actually tighten the levator ani and the coccygeus muscles to try and strengthen them and support the uterus and the vagina and the internal organs like the bladder. So here are the main ones, the levator ani and the coccygeus. Collectively, they make the pelvic diaphragm. A couple more. Here you have the perineum. And then we'll talk about this region actually a lot more when we talk about reproduction. But you can see men and women have the same muscles. If you have the perineal muscle in a man, there's only the urethra for urination and the anus for defecation. In a woman, you have the urethra, you have the anus, but you also have a special slit in here, the vaginal opening, that's right in the middle of the deep transverse perineal muscle. Okay. Later we're going to talk about these sphincters, these round muscles. They could be called an orbicularis muscle, but they call them a sphincter. Here you have one around the urethra, and what we're going to find out when we talk about the kidney is that you have an external urethral sphincter that's skeletal muscle, and that's why we're mentioning it here. But you also have an internal urethral sphincter, which is smooth muscle. That one you don't have to write down, but just keep in mind, smooth muscle is involuntary. So when you have to urinate, that internal sphincter that keeps you from urinating will relax and will make you want to tinkle. And then the external urethral sphincter is the one you have control of with your brain that will pinch off so that you don't urinate, involuntarily. When babies, puppies, kittens are all born, they don't have a lot of control from their brain down their spinal cord to this area of the body, the lower area. It takes time to develop. So what's that tell you? When they have to urinate or defecate, do they have a lot of control? No. Basic involuntary reflexes that control the smooth muscle in this area allow them to urinate and defecate when the bladder's full or the rectum's full. But as they develop the connection between the brain and down here, the skeletal muscle can be under control so that when they have to urinate, they can hold it. Or when they have to defecate, they can hold it. So around the urethra and around the anus, you have a round smooth muscle. It's the internal sphincter. And you have an external skeletal muscle, which is the external sphincter. You just add the different name, urethral versus anal. And when we talk about GI tract and defecation, and we talk about renal or the kidney and urination, you're going to find the processes are basically the same. These two are designed similarly, and the way they function is also similar too. So for now, you just need to know the external urethral sphincter, the deep transverse perineal muscle, and then the external anal sphincter. These muscles I'm not going to hold you accountable for right now, because these, again, well, you've seen the levator ani, but these, again, are going to come back in reproduction a lot. So we'll talk about them when we need to later. Let's go to the thorax, the chest. Right. There are just a few that you have to know. So the first one is going to be the pectoralis major, and you can see here this broad sheet that goes across the clavicle, down the sternum, and across some of the costal or ribs. This is the origin, 3 separate origins. You have the clavicle, you have the sternum, and you have the ribs. All these fibers come together, they converge like we talked about before, and attach to the humerus. Okay. When you move this, imagine your arm is in anatomical position. When this starts tightening, it's going to pull the arm forward. What's it going to do to the shoulder if it's pulling it forward anteriorly? it flexes. Imagine your arm is straight out to the side. If you hold it out to the side, like you're forming the letter T with your body, putting your arms out to the side. If you tighten the pectoralis muscle, it pulls the humerus down and in. It pulls it medially. What is it doing? What's the actual motion? It's adding it to the midline of the body, so it's called adduction, adduction. Next, if we cut across the pectoralis major and we look at the deep muscles underneath, we have the pectoralis minor. You can see the pectoralis minor starts at the rib cage and goes all the way up to the scapula. If you look at the next one, this is serratus anterior. They come and wrap around the rib cage. This one's kind of hidden, you do have to know. This is actually looking at the scapula. It's called the subscapularis because it attaches underneath the scapula. So it goes from the medial border of the scapula all the way out to the humerus, to the lateral aspects of the humerus. It tries to pull in or pull down an adduct. All these muscles are trying to pull the arm down. So far, they're also trying to pull the arm forward. So they would be flexors and adductors. Movement of the scapula. If we flip it around, look at the back of the scapula. Here we have the medial border of the scapula again. From the vertebra to the medial border, you have the rhomboids. There are two sets of them. You have the majors, which are the large rhomboids, and you have the minors, a small brief one. These try and retract the shoulders. They try and pull your shoulder blades back. So if you tighten your shoulders so that your shoulder blade pulls closer to your vertebra, that's the rhomboid doing it. The next muscle at the top we talked about with the cat, the levator scapula. You see it has an attachment at the scapula and also has attachment at the cervical vertebra. When this tightens, it pulls the scapula up and towards the head, like when you shrug your shoulders. Next, here's the spine of the scapula. Above the spine, we refer to this as a supraspinous fossa. It was a groove above the spine. So now you have a muscle in there that's called the supraspinatus. It goes all the way from the medial border of the spine all the way across the spine of the scapula and attaches to the humerus. Next, you have the infraspinatus. It's below the spine of the scapula, attached to the humerus. And then the two teres muscles, the teres major and the teres minor. If you look at them, the teres major starts on the back, the posterior aspect of the scapula, and it wraps around to the front of the humerus. The teres minor starts on the scapula and wraps to the posterior aspect of the humerus. They're actually opposing each other, and these are part of what we call the sits muscles, or rotator cuff muscles. And you've probably heard of them. They're tiny, tight muscles. If you move your arm really quick, sometimes they get pulled and they can be damaged. The tendons can be ripped and pulled apart or damaged. Who do you hear about damaging their rotator cuff muscles the most? People that fling their arm forward quickly, like pitchers in baseball, or sometimes tennis players that are swinging their arm forward. But pitchers in baseball use these really quick to throw a baseball. So little tiny muscles that have a lot of pull on them may have a higher chance of ripping and tearing. So those were the deep muscles. I kind of jumped straight to those. Those you have to know. Whoops. Not sure how that flipped around. Next is the superficial muscle that goes over all of them. And it's called the trapezius. In the cat, we subdivide it into three separate parts. We refer to the clavicle region, the acromial region, and the spinal region. But collectively in the human, we're just going to talk about the trapezius. So you can see the origins start at the cervical vertebra and the base of the skull. They go all the way through the thoracic vertebra and come all the way down and touch the first lumbar vertebra. So they all start along the vertebra, and they all reach out, they converge into one point, the spine of the scapula. When you tighten this muscle, you can pull the scapula inward, you can pull it upwards for shrugging, and you can also depress it. So this is a really tricky muscle because it has several functions. A muscle I skipped over, I actually mentioned in the introduction, but the latissimus dorsi, or dorsi. When you do a lat pull down or you do a chin up or pull up, whatever term you want to use for it, if you hold your hands above your head to do a chin up, you can feel as you're pulling the chin up, all those muscles in your back, those ones pulling down are the latissimus dorsi. These are really powerful adductors, adding the arms back to the side of the body. Okay? They'll also pull your arm backwards from being forward in front of you to the extension or extended position. And then you can see here's the trapezius, and the latissimus dorsi actually overlap just a little bit. Right. Muscles of the arm. So the first one's going to be the deltoid, and I mentioned this earlier. The deltoid looks a lot like a tulip drawn on your arm. So it has an anterior portion, has a posterior portion back there, and it has a medial portion. But the deltoid is broad. It goes across the clavicle and the scapula and reaches down and attaches to the humerus. The deltoid is a very powerful, in fact, it's the primary agonist in abducting or taking away the arm. So you can feel it. Put your hand up there and tighten it. You can feel your arm going up away from your body. It's moving laterally. It's being abducted. When you look a little bit lower on the arm, here you have the bicep brachia. The bicep has two origins that I mentioned in one of the first slides, and it has one insertion. So it comes all the way from the upper arm, actually on the scapula, goes over the humerus and attaches to the radius. It's a powerful mover and flexion of the arm. The tricep brachia, you can only see two of the heads actually. It's on the back side of the arm, and I have a better slide that'll describe it later. Okay. The brachialis muscle sits directly underneath the bicep brachia, and then the brachioradialis. The brachioradialis, if you make a fist with your right arm, just make a fist like you're going to punch somebody, like you're the Hulk, and take your fist and you pronate it, you twist it. Feel that arm or that muscle that's bulging in your forearm? It sits on the lateral aspect, and it goes all the way actually from the brachial region, your humerus, all the way down and attaches to the radius on the top. You can feel that thing bulging right here on your forearm. It's the brachio, starting up in the arm region, radialis going down to the radius. Turn the arm around. We've already listed some of these deep muscles on the scapula. We've talked about the latissimus dorsi. And now the major muscle on the back of the arm is the tricep brachii. There are actually three heads on it that originate at the scapula and the humerus, and they reach all the way down and they attach to the olecranon process on what bone? The ulna. Ooh, I may have had a typo earlier and didn't catch it. So if I typed the radius on accident, you should probably fix that. It's on the ulna. So there were the slides we just went through. Right. Muscles of the forearm, I mentioned this earlier. If you're looking at the muscles of the forearm, on the front of the forearm are almost all flexors. Their primary movement are to move the hand. When we looked at that dissection video with Gunther von Hagen, the guy that did the Body Worlds exhibit, he put that pin in the palm and showed you by pulling the flexors on the hand, or on the forearm, it caused the hand to flex, to grab a hold of that pin. If you look at all the flexors on the front, all of their origins are actually on the humerus. They start at the epicondyle, that little bump above the condyle in the humerus. But which one? Feel them. Tighten the muscles on the front of your forearm. Make a fist. And make the fist like you're going to punch yourself in the face. Feel all those muscles and how tight they are. Where do they go? Do they go to the lateral side of the humerus, or do they go to the medial side of the humerus? They go to the medial side. They run in towards the middle, the side that's closer to your rib cage. If you look at the muscles on the back of the hand, flip your wrist over, keep it flexed, but pronate it. Feel the muscles on the back of your arm, tighten them. Feel where they're coming from. All those muscles start at the lateral side of the humerus. So the forearm muscles all start at the distal end of the humerus. The flexors start at the medial epicondyle, and the extensors start on the lateral epicondyle. When you tear or you damage these tendons at the epicondyle, they call it epicondylitis, and it causes things like tennis elbow or golfer's elbow or little leaguer's elbow. Let's start with the flexors. I'm not going to make you remember every one of them, but if we describe them on the cat and we dissect it on them, you're going to have to know them. So let's talk about a couple of them. All right, first let's talk about the pronator teres. So the pronator teres, you can see it. What's its main job? Pronator teres is to pronate the hand. Right, flip the hand over. We also talked about these three muscles. Right, they're all on the front of the arm, so what are they doing? Extending or flexing? They're flexing. The first one here, the flexor carpi radialis, is telling you it's going where? Well, it says it's running over the radius, and where's it extending to? It's going all the way down to the carpi, which is the wrist. Remember carpal tunnel? Carpal? So it's telling you it goes all the way down to the wrist on the radius side. If you have a radial one, you must also have a what? An ulnar one. So the next one, the flexor carpi ulnaris, goes all the way down to the ulnar side of the wrist. And then right in between the two, you've got the palmaris longus. And remember I told you that's kind of like that minnow or that fish. So the palmaris longus is a little hidden right here in the human, but it was really prominent inside in the cat's arm. It goes all the way down, and it forms that tail-like structure, the aponeurosis again. That's a webbing across the palm of the hand. If you tighten your wrist, like you're going to punch yourself in the face again, notice that big tendon that pops out? What's interesting is if you don't notice it, you're like 5% of the population. 95% of the population actually have a big tendon popping out there that's the tendon of the palmaris longus, but 5% of the population don't have it. So maybe you're more evolved than us. Maybe not. The next thing is unique. It's not a muscle, but you really have to understand it. It's called a retinaculum, and a retinaculum is a wrapper. Imagine if you put a piece of duct tape across your wrist and wrapped it all the way around. That retinaculum, that wrapper, holds all the muscles' tendons in place. If you didn't have the retinaculum, these muscles would pop out and they wouldn't pull very well. It's kind of like a pivotal point. Or if you have a pulley, if you have a lever, the round wheel, the pulley part that you're running the rope over, the retinaculum is just like that. They call this side the flexor retinaculum because it contains all the flexors, all the tendons of the flexor muscles. And then the last muscle you're going to have to know on the front of this is the brachioradialis that we talked about. It starts at the brachial region and goes all the way down to the radius and attaches. A couple other ones that I'm not going to hold you accountable for. Actually, there are two that I will hold you accountable for, so I should be careful. But here you have the flexor digitorum superficialis. Look at the name. What's it doing? It's a big, broad muscle. Where's it at? Is it deep within the arm, or is it close to the surface? It's the superficialis. It's close to the surface. It sits superficial. You know, I told you when you hear the word superficial, think of people that are superficial. Everything about them is on the surface. You know, a lot of times you refer to them as bad people on the inside, and all the good traits are superficial or on the surface. Deep. If you have a superficialis, you have to have something that's deep to it or down inside. People that are very deep thinkers, we call them profound thinkers. So the muscles that are named after deep are called profundus, profound. So if you look at the picture here, you have the flexor on the front of the arm, digitorum that tells you it's moving what? The digits, and it's the superficial version. Flexor digitorum superficialis. If you cut that away and you look just below it, you have a flexor digitorum profundus, a deep one. So again, if you find something that's superficial, look for something profound. If you find something that's extensor, look for what? A flexor. If you find something that's an inferioris, look for a superioris. Try to look for patterns again. Try to make things make sense for you. So the flexor digitorum superficialis and the flexor digitorum profundus are two that I'll have you remember. In fact, when we do muscles, sometimes I'll take a TENS unit and I'll hook it up to the flexor digitorum superficialis, and I'll shock a person, and you'll watch their hand actually shut because the electrodes will make this clench, and you can see all these tendons. They go all the way across to each of the digits. Another word to watch for is pallicus. And I'm not going to hold you accountable for these, but look at the names. Flexor pallicus longus. You know what that is. What's the pallex? I told you to memorize it. In the hand, the pallex is the fancy word for the thumb. So what do you think this muscle does? It goes all the way up into the thumb, see it, and it causes flexion. It's a long one, so you must also have a brief one, a brevis. And the brevis is not in this picture, but you have it in there. All right, let's flip the arm over and look at the back. So the back of the arm, just like the front, I'm going to hold you accountable for the names of the muscles that we looked at in the cat. So I'm not going to hold you accountable for these. Remember, pallicus, the cat didn't have that. The cat has a thumb-like structure, but we didn't point it out. So extensor is telling us on the back of the arm. Pallicus means it's going to the thumb. Longus is the longest one, and brevis is the short one. Right? So let's go to the ones we need to know. First, extensor digitorum. So you can see it starts at the lateral aspect of the humerus. It goes all the way down to the what's? The digits. Yeah, it goes to each of the digits. So if you take your hand and you spread your fingers out and pull them back, that's the muscle that's tightening. And you can feel it in the back of your forearm too. Right. Next one, extensor carpi radialis brevis. In the cat, we just call it the extensor carpi radialis. What's it do? It extends the paw in the cat, extends the wrist in us. And that's extensor carpi. And then the radialis says it sits on what side of the arm? It sits on the side of the arm with the radius. If you have an extensor carpi radialis, you must also have an extensor carpi ulnaris. And there it is. Extensor carpi ulnaris. It goes on the other side, the medial aspect of the wrist. Pardon me. All right, a couple of the deep muscles. You had a pronator on the front side. So what's the opposite of pronator? A supinator. Remember, a pronator makes you flip your hand over like you're accident prone, like you're going to land palm down. A supinator flips it back like you're holding a bowl of soup. Right. I am not going to have you accountable for the intrinsic muscles of the hand. This is a little bit more detail. If you're going to become a plastic surgeon or you're going to work for a plastic surgeon, then they'll make you go through and relearn these. But there's so many muscles in the hand that I'm not going to waste your time thinking about them. Right. But I will point them out. There are two special structures on the hand, though. You have the thenar region and the hypothenar region. The thenar region is where the ball of the thumb is. So imagine you're kneading a ball of dough. If you put your hand down on the counter, okay, that meaty part, well, let me show you a picture. This meaty part right here is the thenar region. Okay. The hypothenar is over here. These are the parts that you would push down when you're kneading dough or you're rolling out a pie crust or whatever you're doing. There are a lot of muscles that are controlling these. Like for instance, on this side, they're primarily controlling the what? The pollex. What was the pollex? It was the thumb, right? So you can see all these terms. Opponens pollicus, the abductor pollicus, the adductor pollicus, the flexor pollicus. They're all going to the pollex. Right? The other side, the hypothenar, primarily has pinky finger. So you see them. You have opponens digiti minimi. It's pronounced minimi, but I always think minimi, like Dr. Ebel and his minimi, right? He puts his little pinky finger up to his mouth. So when you see minimi or minimi, you know it's always on the hypothenar region. Right. And then you can go through and look at these on your own, but again, I'm not holding you accountable. All right, we've done 45 minutes, so now it's time for a break, and you can take some time, relax your brain, and then I will record part number 2.